COVID-19 Practice Tips from AAHA members. The global pandemic of the novel COVID-19 disease sits heavily on our minds, and every day many of us find ourselves asking several questions about life moving forward, to which there are no easy answers. Animal health care needs will continue even as other facets of life come to a standstill. If your veterinary practice remains open for appointments, whether routine or emergency only, you likely find yourself asking, how can I best protect my clients, teammates, and myself from contracting COVID-19? There has been good news. As of March 20th, 2020, the United States Center for Disease Control states that no evidence suggests that companion animals risk contracting or spreading COVID-19. Still, you must consider, how can I continue to provide the best care to my patients? Though AAHA has yet to determine what the best practices are in these circumstances, we have seen an influx of members sharing advice to one another for how best to address these questions. This video will provide an overview of what we've seen shared. Please refer to the United States Center for Disease Control, the World Health Organization, or the U.S. National Institute of Health if any information in this video contradicts current recommendations. AAHA member advice. Limit the number of individuals who accompany pets to appointments. Per the World Health Organization, maintain at least 6 feet of distance between you and all other individuals. Change your appointment policy, limiting the number of people allowed in to 1 owner per visit. Close your lobby and public waiting areas. Provide ample spacing between appointments so you have exam rooms available for each arrival. Ask clients to call when they and their pets arrive and escort them directly to an exam room. Close your entire practice to non-employees. Ask clients to wait in their cars while you and your teammates conduct exams and diagnostics. Have an LVT or assistant take patient history over the phone and then retrieve patients from the vehicles and bring them into the building. Call the owners after the exam to discuss findings and answer any questions. Use safety measures when retrieving pets from vehicles. Ask owners to place cats and smaller dogs in carriers before opening car doors. Carry 2 slip leashes out to the vehicle for retrieving larger dogs. For liability reasons, place both leashes on the dog rather than trusting the integrity of the owner's leash. Provide telehealth consults before making appointments. Use phone and video chatting capabilities to provide consults to clients on platforms such as FaceTime, Skype, and so on. Be on the lookout for telehealth platform promotions that will likely be offered in light of recent events. A valid VCPR must already be established. Remember that the virus responsible for COVID-19 remains stable on many surfaces for hours or even days. According to the National Institute of Health, it is stable up to 24 hours on cardboard, and for up to 2 to 3 days on plastics and stainless steel. Be mindful of all items with which you come in contact. Wear gloves whenever necessary for opening deliveries and disinfecting surfaces. Reusable masks and caps continue to align with the AAHA mandatory standard MA41A.1, disposable or reusable caps and masks that are laundered for each day's use. Continue to launder them daily. Save sterile masks for veterinarians and surgical settings. AAHA members have shared mask sewing patterns on the AAHA Accredited Members Facebook page. Per the American Hospital Association, elective surgeries are discouraged to conserve sterile gloves and gowns. Disinfecting exam gloves using hydrogen peroxide and peracetic acid, or autoclaving exam gloves, may be alternatives to sterile surgical gloves. If a staff member is exhibiting symptoms of COVID-19, follow necessary precautions. Send your team member home to consult their physician. Alert your work team to a possible exposure, but maintain confidentiality as required by law. Flexible sick leave is important. Example of precautions from the New York State Department of Health. If person A is confirmed to have COVID-19 and has worked closely with person B, who lives with person C, person A confirmed case, should be isolated. Person B, contact of confirmed case, should be isolated. Person C, contact of a contact, does not need to be isolated unless person B develops symptoms or tests positive for COVID-19. If gowns aren't available to care for pets who live with a person who has COVID-19, consider using palpation gloves and garbage bags. Stay informed. Visit aha.org/COVID-19 for news stat articles and regular updates on AAHA's response to the outbreak. Refer to the 2018 AAHA Infection Control, Prevention, and Biosecurity Guidelines at aha.org/biosecurity. Before communicating new information, verify it on the CDC, WHO, or NIH websites. If you are an AAHA member, continue to adhere to our practice standards. Check for new advice on the AAHA Accredited Members page on Facebook. AAHA does its best to amend and correct misinformation shared on this page. However, please use your discretion in what advice you take and be cognizant of unsubstantiated rumors. It bears repeating. Remember the symptoms of COVID-19: fever, cough, and shortness of breath. According to the CDC, these symptoms may present within 2 to 14 days of exposure. Be safe. Wash your hands frequently for at least 20 seconds using soap and warm water. Cough and sneeze into tissues whenever you can, or into the crook of your elbow or upper arm. Only wear masks in public if you are exhibiting symptoms of COVID-19. Socially distance yourself whenever possible. Thank you for your time. We at AAHA wish the best of health to you, your teammates, your family, your friends, and of course, the pets whom we all love and care for.